Welcome to DMG TV2's Medical Minutes here on Time Warner Cable. This is the sports edition, hence the outfit that I have on today. We are going to a lot of places. Woody Hayes Quaker Stadium. We'll be going over to the Healthplex at Union Hospital. But we're going to start out right here with Dr. Melissa Bickett. She is an orthopedic surgeon. She specializes in sports medicine with Omni Orthopedics. They have offices in Dover and in North Canton. Thanks for coming on Medical Minutes.
Thank you for having me.
Your job fascinates me. Tell me what an orthopedic surgeon does. What do you do?
So if you look at orthopedics in general, it's essentially the profession or the specialty of fixing bones and the muscles and tendons around them.
And so how do all those tendons and ligaments hold on to your bones?
Just as we develop in utero, you end up getting the attachments, and essentially that's what makes our body move. And so our specialty is really about getting the body back in motion. And
did they become injured and tear and have problems easily?
Some people are more prone to it than others. And so, like me personally, I've never had a lot of sprains or strains, but there are people all the time, a lot of repeat customers. They come back in and they just always re-injure that hamstring, or they always hurt that shoulder, and they always come back in.
And what kind of patients do you see on a typical day?
Typical day, average patient ages are between like 14 and 55 to 60. A lot of high school kids come in since I do sports medicine, so like ACLs, they had a shoulder dislocation on the field, their hips hurting them. And then you tend to get kind of your weekend warriors that come in, and they were out playing softball over the weekend and they slid into the base, and now their hand hurts. Or as you get your older patients, then a lot of times they'll have a lot of shoulder problems, they'll start getting some arthritis, and we see all of that.
And you like to focus more on rotator cuffs, hips, and knees, right?
Yes.
So tell me, let's start with shoulders. What happens with your shoulder that you have some kind of problem? What develops?
So in the younger kids, like let's say they're playing football, they'll get a shoulder dislocation.
Where it just pops out?
Pops right out of place. And what happens is that'll tear the kind of cup that holds their shoulder, and it'll tear the labrum, or occasionally they can get some bony damage actually to the bone. And so if I'm on the field, I'll put their shoulder right back into place immediately.
Doesn't that hurt? It just pops right back in?
It doesn't pop back in easily. It kind of depends what time you catch them at. But you put it back in place, and then what you end up doing is getting x-rays and MRI and seeing what kind of damage was done. Sometimes you can treat it without a surgery, sometimes you have to do a surgery.
And what's the difference between an x-ray and an MRI?
So an x-ray looks pretty much just at bone, and the MRI looks at the soft tissue around the bone.
But they're both similar. If you're looking at soft tissue, how come that doesn't show up in an x-ray?
Because the bone is more radio dense, and kind of a way to say it is the x-ray beams pass through, and the thicker something is, the more you can see it. And so since your skin and your muscle is not very thick, the x-ray passes right through. And the x-ray is what you think of where they put a plate underneath and they say shot, and you can put up the x-ray. The MRI is where you get shoved in the tube and it goes click, 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 really loud all around you.
And I mean, that's obviously more helpful to get an MRI.
For sports medicine, it can be more helpful to get an MRI. But the x-ray is a very basic orthopedic tool that we all use.
Okay. And then what about hips? How, I think of hip fractures because they're elderly and have osteoporosis. But a kid has a problem with their hips. How does that happen?
So sometimes, and what they're looking into is how this develops, and it's called femoroacetabular impingement. But essentially, I know,
what?
It's a big word. It's a big word, but essentially what happens is as these kids are doing specific sports, they develop kind of extra bone or bony bumps, and then it ends up hitting the labrum as they bring their hip up or as they twist certain ways, and so they end up getting labral tears. And that's what you kind of hear of, A-Rod on the Yankees, he had a labral tear, and there's a lot of other professional athletes that people are starting to learn about now that have these labral tears, but you may not even know you have this problem until your hip starts hurting. And true hip pain is actually more like groin pain. They'll kind of point right in the front and say it hurts right here.
And then knees. You said ACL. What's an ACL?
So an ACL is a ligament that runs right through the middle of the knee, and essentially it stops your tibia from going too far forward, or your shin bone. And so the way we test it if it's torn is we'll hold your femur or your thigh bone still, and I'll pull forward on the shin bone to see how much it moves, and that tells me if the ACL is torn or not.
And what do you do for that?
So we end up doing what's called a reconstruction. You take a piece of tissue, whether it's part of your patellar tendon, whether it's part of your own hamstrings, whether it's tissue from another donor, and you pretty much remake the ACL.
So you can just kind of sew it back together.
Simplistically, yeah.
And then how much recovery time do you need before the kid can go back and play?
Well, they say on average for, like, if you do a patellar tendon, which has 2 little bone plugs with it, it's about 4 to 6 months. If you do a hamstring or a graft from another donor, it's usually 6 to 9 months.
Oh, so they're not going right back out onto the field to play.
Yeah, and even the professional athletes, they're holding them out at least 4 to 6 months, because when your job depends on you being able to do something, you want to make sure you're 100% before you get back on the field.
Any way to prevent that?
They're starting to come out with some ACL prevention programs that focus on strengthening and pretty much proprioception, so doing like plyometrics and strengthening the quads and hamstrings, and they think that can help, especially in the female population.
Why?
They found, and there's lots of different theories, it's one of those things that it's gray, but what they're finding is that the female population is more prone to it, and that's just looking back over the history. Women, especially the younger girls, almost 2 to 1 are more prone to tear their ACLs compared to guys.
Because they
move
differently, they're shaped differently?
A little bit. I mean, they looked at the shape, they were thinking hormones for a while. Landing differently from a jump is really the biggest thing that they're finding. So they're finding that women, when they go up and then land from a jump, that they're letting their knees kind of cave in, and that they're landing differently, and that puts a lot more stress on the ACL.
So strength and conditioning and stretching up and warming up is really important.
Yeah.
All right, very good. Melissa Bickett, she is an orthopedic surgeon with Omni Orthopedics in North Canton and Dover. She's specially in sports medicine on this special sports edition of Medical Minutes. Thanks for being with us.
Thank you very much.
A nursing home or your own home, it's good to be home. So call Ember Complete Care for all your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home, for skilled nursing, physical therapy, wound care, and more. Locally owned and operated, Ember Complete Care has been servicing all of Tuscarawas and Coshocton County since 1986, with a yearly average of $75,000 donated back into the community. Call 1-800-462-0909. Ember Complete Care. It's good to be home.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, Newcomerstown, and Millersburg. Let's get started building our relationship.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Welcome back to Medical Minutes here on DMG TV2, and we are at Woody Hayes Quaker Stadium in New Philadelphia. This segment we are talking with Todd Steele. He is a certified athletic trainer with the Healthplex at Union Hospital. And Todd, tell us a little bit about what you do. What is a certified athletic trainer?
Okay, a certified athletic trainer is a licensed professional in the state of Ohio. What we do is we are trained in the evaluation, the recognition, and the prevention of athletic injuries. So we primarily serve as a liaison to the parents, to the docs in the area, for athletic injuries that occur, and we just try to get them to the right place to be seen at the right time.
Now, when you were getting the New Philadelphia Quakers here ready for practice today, what were some of the things you were taping up? What were you doing in there?
Okay, a lot of what we do pre-practice is just trying to support joints that are injured, sprained, strains, typical things that happen with contact sports, but also non-contact sports. We help out with all athletics here at the school, including soccer, in-season soccer right now, cross country, volleyball.
And what kind of injuries do these kids have?
The majority of all the injuries that we have, minus the more traumatic injuries, are joint sprains and strains. So strains to the musculature and joint sprains, elbows, knees, ankles primarily.
And all you have to do is tape them up and they can go back out on the field?
Absolutely not. We have a team physician who guides me in what we do. I communicate with him closely. We also have a group of orthopedic surgeons in town at East Ohio Orthopedics that work with us to help our kids be seen as frequently as we can get them in there, so they expedite that care so that I know what I'm doing.
And what we were witnessing was a line of kids coming into your office, and they had a variety of different things. Some of them were just an open wound.
Yeah, that's what we're here for. That's what we do in the community. We have 5 schools that we contract with to provide certified athletic training services to. And so we're going to help with skin issues. We're going to help with contagious skin issues. We're going to try to make sure things stay clean so they don't become infectious. And on top of that, we're going to do the daily routine of getting kids back on the field for practices when they are cleared by the doctors to be taped, to be braced, and back on the field.
Now, I'm used to something called coach's tape, but you were using something kind of springy and stretchy along with the pre-wrap, and it sounds very complicated.
No, it's just our secret here. It's what we do. So there's a variety of different tapes, just like anything in life, and sometimes joints need a little bit more mobility. They need some support, but they need the mobility to actually feel comfortable. And so I'll tape for support, but we're looking to have them be comfortable too. That's just how I do it.
Tell me a little bit about what kinds of injuries these kids have, and does it get worse as they get older if they continue to play?
Okay, so what we try to do is determine a timeline for when they return and what is safe for them. And we use function as the ultimate clearance for our athletes. So when they can function at a level that is healthy and they can participate and contribute, we will do that. But we also understand that there's different timelines for healing following different types of injuries, sprains, strains versus dislocations or even fractures. So that can have a carryover later in life if they don't take care of it now. And hopefully we're making the best decisions for them to return. But they don't consider themselves just student athletes. They want to play on Friday nights. And so they understand the risk, and the physicians explain that to them, and they understand when it's time to come back.
And is a sprain worse than a break?
It just depends on what type of sprain. If you've heard that, it can be true. Sometimes sprains can take up to 6 weeks to heal, and you can have fractures that take 4 weeks to heal. So it just depends on the injury, I guess.
And when do you decide that the athlete needs to go to the emergency room?
Obviously, if it's a life-threatening injury or if it's an issue with a fracture, a bone like you were talking about that could have some instability, and we need to know that night for the sake of the student athlete and the parents that it's going to be stable, that it's not going to become more unstable overnight because we just didn't take the time to do it right. So the emergency room is a great place to get imaging and certainly follow up with any type of head injuries, trauma that needs to be seen immediately.
Well, that brings us to the discussion on concussions. There is a big push to make sure that they are reported and treated. What is a concussion?
Concussion is an injury to the head that includes the brain. It's a jostling of the brain. It's essentially a bruise that has many different symptoms that can be presented by the student athlete. But ultimately, what we're called to do is follow a law that was passed last year. In April of 2013, the state passed a law that suggests to us our role is to take an athlete out of participation if they exhibit any type of head injury. So it's pretty, there's no real gray area. It's black and white. If they have a head injury, they're coming out. They're not returning to play that same day. We'll get them evaluated by a physician, and if it isn't a concussion, they can come back to play. If it is a concussion, we have a protocol that we follow issued in that law that would allow them to come back to play in a given amount of time.
And there are different severities of concussions. Some kids end up in the hospital for a long time.
Sure. I don't know about a long time, but I do know that there's concussions that present with very little symptoms. There's concussions that have the student athlete present to us with symptoms daily for up to 2 and even 3 weeks. And then there's those concussions or those impacts that leave an athlete unconscious. And so while there's not great guidelines for how we grade them anymore, and there used to be, we're more accepting of the idea a head injury needs to be evaluated on a daily basis, and the right decisions need to be made for them to come back, again, according to that law.
And sometimes the student, the athlete, isn't going to report that concussion because they want to play.
Sure, and that does happen, and there are a variety of reasons for that. Sometimes they don't know that they're hurt, and so education is being done on the front end of that by the high school, by the Ohio High School, where students and parents have to sign off that they're aware of symptoms of concussion. But despite having signed that form, sometimes athletes just don't know that their head is hurt in a manner that could leave them subject to a second injury or potentially worse and long-lasting brain injury. So that's why we're here. We're here to hopefully glean information from other players, coaches, officials that witness the event and get them evaluated right away.
And as you said earlier, the number of concussions, you want to limit that to none, of course,
Sure.
But once you've had one, you're really under the microscope.
Yeah, there's definitely some research that suggests, both for guys and girls, that you're more suspect to a second injury after the first one pertaining concussions. So ultimately, like every injury, they need to heal. They need to have proper healing time, and we need to do the things that we know are right, including a return to play protocol that gives us good information, both objective and subjective, from the athlete that we can go by to release them.
All right, very good. Integral member of the team is your trainer, Todd Steele. He is with Union Hospital's HealthPlex. He is a certified athletic trainer, and we have been talking with Todd here at Woody Hayes Quaker Stadium in New Philadelphia. For DMG TV2 Medical Minutes, I'm Jennifer Clark.
Hi, I'm Elaine Miller with Naturally Green Cleaning Service. My company serves both commercial and residential clients. We do general cleaning, spring and fall, empty homes to get them move-in ready, and final cleans for new construction. We use eco-friendly cleaning products that leave your home or office fresh, clean, and safe for you, your family, pets, or coworkers. Our focus at Naturally Green is to provide excellent customer service paired with outstanding work to build a relationship of trust with you, our clients. Having served the area 4+ years, we have had many referrals and testimonials that you can access on our website at www.naturallygreencs.com. Our work sells itself, therefore we have never had any contracts even with our largest commercial accounts. Call us today for your free quote and see what makes our company stand out.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers & Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, New Comerstown, and Millersburg. Let's get started building our relationship.
Hi, I'm 1450 WJER's Bill Morgan, inviting you to join me on television Wednesday evenings at 7 and Friday afternoons at 5 for TV2 Sports Talk. Sports Talk is your weekly look inside high school football, volleyball, soccer, and more. Look for guest appearances from your favorite area coaches and players. TV2 Sports Talk, Wednesday evenings at 7 and Friday afternoons at 5 on DMG Channel 2 on Time Warner Cable.
Welcome back to Medical Minutes here on DMG TV2. This time around, we are at the Healthplex behind Union Hospital, and we are talking with physical therapist Lucas Boylan. And Lucas, we've already talked about kind of surgery that happens with injuries. We've talked to trainers who are out there on the field and the court with these players. But once they've been injured and treated, they end up here at the Healthplex, correct?
Yes. Usually what will happen is they will, after the evaluation process like you stated, they will come in here for a follow-up with us or an evaluation, and we will just assess them based off of what the doctor has already found, whether they are indicated having the surgery, or if they want us to treat them non-surgically, and trying to get them back onto the court or onto the playing field as soon as possible.
And when I think of physical therapy, I think of like what you see here, these treadmills and lots of exercise. And don't we already do that?
Yeah, we do to some degree, but what we're able to do at times is maybe isolate some muscles that you're not used to using. A lot of the movements that you will do in a weightlifting program or in any type of athletic background is more so for muscle groups, to where we can isolate some of the muscles out and try to key on certain areas that you're having difficulty with, as well as maybe providing you with something a little bit different, whether it's a modality or some sort of manual therapy, something of that nature.
So what's a typical physical therapy course? What do they have to do?
In terms of the athlete themselves, what they'll go through, what we'll do at first is we'll just assess them just to kind of see where their issues are. We're provided with their diagnosis. So say if someone has a knee issue, it is explained to us what their knee issue is, and then we just try to assess them just to see what certain things bother them or what certain things feel comfortable for them. We usually try to avoid the things that are painful because we're not wanting to feed into the pain. We're wanting to try to help with that. So if someone comes to us and there are certain things that they can't do, like if they can't, say it is a knee issue, and they can't squat very far, we'll limit their range of motion with the squatting, or we'll limit them in terms of the lunging to avoid the shear force across the knee.
So how do you then make sure that they increase that range of motion?
Well, what we'll do at first is we'll try to strengthen them up in the range of motion that they're comfortable going through, and then we'll have them work on stretching and things of that nature to try to improve the range of motion themselves without having weight bearing through their legs. And then once they're comfortable going through those ranges, then we'll try to strengthen through those ranges, and then that will be how they would see progress. So if, for example, if I'm just raising my arm up and it hurts here, as I strengthen up in front of my body, then maybe I'm able to raise my arm higher by stretching it, and then I'm more comfortable going up with strengthening it then.
And to have a physical therapist actually go through the program with you is probably more successful than if you were trying to do it on your own?
Yes, that is correct, because oftentimes what will happen is if we give them certain things to do, they'll usually follow us while we're in here, but then once they leave here, oftentimes they won't do it, even though, because we try to explain to them there are several hours in the day that you have that you're not here, because at most we have the athletes in here anywhere from 2 to 3 times a week for anywhere from a half hour to an hour at a time. So that leaves a lot of time when they're not doing physical therapy with us. And so the carryover, if they focus on that, that usually will be beneficial for them in the long run.
Now, is there something different? We've been talking about knees, but hips and shoulder injuries, is it all the same therapy?
Well, it'll vary based off the diagnosis, and also if they had surgery. Usually it's a longer process if they have surgery in terms of the entire physical therapy prognosis in terms of, and then also the frequency and duration of which we will see them. We'll usually see them longer. And then non-surgically, they're usually trying to get back onto the playing field as quickly as possible within that year, if you will, in terms of within the sport itself. So if someone came in now having a football or volleyball injury, they would want to return to the sport with it as quickly as possible, within a few weeks. If someone had surgery, maybe they're trying to focus on getting back to basketball or softball, something of that nature. And so if it's surgically, the time frame is usually longer. If it's non-surgically, it's usually less. And that goes for any diagnosis in terms of hip, shoulder, knee, which we do see them all here.
And how do you get your patients? Are they all referred?
Yes, they are. If some of the athletic trainers feel that they need the patients to go see the orthopedic surgeon or just an orthopod in general, they'll usually refer them there, and then oftentimes they're then referred to us. Then sometimes, though, that the patient is just treated directly by the athletic trainer as they're going through their sport.
Depending on the severity of their injury.
Exactly, yes.
And so physical therapy, when I was young, I never heard of it. And now everybody does it. Like, how does this trend change?
I think a lot of the change has been due to insurance companies with the change to before you can get certain medical screenings such as MRI, they'll usually have you come in for non-screening or interventions in terms of being seen by us. And if you're seen for a certain period of time, okay, they're not getting better with physical therapy, let's look further into it, get an MRI, something of that nature, and then possibly needing surgery from there. But even sometimes after they get the MRI, they're like, hey, we'd like you to try this first before we would even pursue surgery because we think you might actually get better if you continue with physical therapy.
And also, do you think you get more young people as well as older?
Yeah, we definitely are seeing we are actually the busiest that we've ever been this year. This is the Healthplex has been here since '99, and they even had therapy in the basement of the hospital before they moved over to here. And this is the busiest that we've ever been in terms of patient population. And yes, we are starting to see more and more young people. The baby boomers, of course, we see a lot of them. That's probably the majority of the people that we see. But we are starting to see more and more athletes because people are starting to become more aware of their injuries, and also you're having more incidents of injury, it seems like, and just because of the higher level of athlete that we seem to see, everybody seems to be faster, bigger, stronger anymore, and then that can create some issues in terms of when collision occurs.
And you can help them get back.
Yeah, as best as we can, yeah.
Very good. Physical therapist Lucas Boylan here at Union Hospital. Now I want you to show me a couple of things here. We're with these treadmills, that seems easy enough. But free weights, and that sounds so confusing to me. And how do you know what to choose for your patient?
What we will usually do is, based off their diagnosis, we'll try to find things that are comfortable for them. In compensatory muscles, in terms of, say, if it is a shoulder, we'll work on their shoulder blades as well as their elbow. Before we get to the shoulder itself, I'll usually tell them we'll work from in, which is the shoulder blades, before we go out, and we'll work from down before we go up, so elbow to shoulder. So you just try to strengthen up those areas just to make sure that they're able to help out with the shoulder before you get it to the shoulder directly, because sometimes the compensatory muscles, when using those aren't as painful as when you work the shoulder directly or any other muscle directly.
And is there a difference between boys and girls?
There will be, in terms of certain things that we look for. ACL is a hot topic in terms of patient incidence injury. So usually what you see there is with the girls, you'll have a higher incidence of non-contact ACL tears, whereas with the boys it'll be more so they're getting hit in the knee to create the injury. People always say, well, it's because as the boys and girls hit puberty, with the girls with the widening of the hips and things of that nature, it's not necessarily that, it's muscle weakness in general, in terms of the areas where you have the muscle weakness different from the areas of weakness in a boy.
And we were speaking with Dr. Bickett earlier in the show today, and she was explaining that very same thing, that there are different things that you can do to prevent these injuries, but by the time they get to you, they've already been injured.
Yeah, oftentimes they are. We do try to teach prevention if they just have something that is minor. If say they do have like a knee sprain, strain type thing, we'll show them things to try to prevent a bigger injury, such as the ACL. So we'll take them through a few things, trying to strengthen up those muscles that are usually at a high incidence of weakness. That can sometimes lead to the ACL tear. So then we'll try to strengthen up those muscles, have them follow a plan with us, and then try to have them carry out a plan if they're willing after they see us, and then just kind of incorporating that with not only themselves but maybe with the teams that they're working with then too.
All right, so the key is do your physical therapy.
Yeah, exactly, yeah.
Lucas Boylan here at the Union Hospital Healthplex on Medical Minutes DMG TV2.